Good evening, all. My name is Kriss Petrovskis, and I'm a third-year Doctor of Pharmacy student in the College of Pharmacy. I'm originally from Dexter, Michigan, and I earned my undergraduate degree at Michigan State before coming to Columbus. As a fellow, I addressed high blood pressure management in the Northland and Greater Columbus areas. I implemented a high blood pressure education and prevention program called Team Up, Pressure Down at Helping Hands Health and Wellness Center. Helping Hands is a free clinic that provides medical and social services to uninsured patients below the 200% federal poverty level. Team Up Pressure Down is a pharmacist-driven program focused on educating patients about the importance of healthy lifestyle modifications and medication adherence to decrease blood pressure. The broader goal was to empower patients with the knowledge, motivation, and tools to reduce blood pressure and ultimately improve cardiovascular health, reducing the risk of heart attack and stroke. I also focused my efforts on recruiting a team of pharmacy student volunteers to join the program. I was blessed to cross paths with two students who jumped on the program, became very involved, and are now joining us this evening as 2014-2015 fellows, sustaining and expanding the project for next year. Last fall, I worked with a patient who left an especially profound impression on me and the other volunteers helping that day. I'll refer to this patient as Linda. Linda was a patient who had been seen at Helping Hands regularly over the last several years. She had high blood pressure, high cholesterol, and diabetes, three conditions that put people at very high risk for heart disease and increased risk of heart attack and stroke. Linda was also a heavy smoker. She smoked a pack a day since she was 16. She's now 56. One fall day during clinic, Linda approached our booth because she knew we were helping patients with high blood pressure. After talking to Linda for a few minutes, it became obvious that discussing smoking cessation with her would be the area she could benefit from most. We stressed how much she could improve her health, particularly her heart health, by quitting smoking. She seemed reluctant. At first, we finished counseling Linda on other important lifestyle modifications and medication adherence. We wished her well, and we expected we may not see her again, as is the case with many patients at Helping Hands. Several months later, we saw Linda again. She had a different pep in her step. She seemed more energetic, but the biggest change was in her voice and breathing. She approached our booth and asked if we recognized her. Of course we did. If we didn't by name, we certainly did by face. She had a grin on her face, and she started to speak. Remember that lady you met back in the fall? Smoking a pack a day for 40 years? Well, that was me. Keyword was. I'm done with it completely, and I owe it to you. We were blown away. Linda went on to tell us about the profound impact we had on her when we first met her in the fall. She appreciated the comprehensive information we discussed about positive lifestyle modifications to improve heart health. The part about smoking cessation really stuck with her. This was a special moment. This is a moment where I realized my program made a positive impact on someone's life. That maybe we prevented a heart attack or stroke happening in a few years. I'll never forget that feeling and how it influenced my perception of my program's value to the patients, to Helping Hands, and to the Albert Schweitzer Fellowship. Team Up Pressure Down would not have been possible without the help of some very generous people. A big thanks to Steve Burson at the Kroger Company, who supplied the program with an in-kind donation of 90 blood pressure monitors. Thank you to Dr. Anna Haas-Garris, my academic mentor and College of Pharmacy faculty member, for helping develop the initial ideas about the program and implementing it. Thank you to Joyce Bergault, my site mentor and Helping Hands director, for continued logistical support and helping to connect me with a grant from Molina Healthcare for the program. Lastly, thank you to Jerry Cable for being the spark that introduced me to the fellowship, for encouraging me to apply for it, for advocating for my program at Helping Hands, and making it an integral part of the patient care process. Moreover, thank you for your years of service to the College of Pharmacy, in particular to students in outreach and engagement. May you enjoy your well-deserved retirement and time with family. Thank you.